Good afternoon, everyone. My name is David Chard, and I have the privilege of serving as president of Wheelock College. Last evening, and at this morning's undergraduate commencement, we honored 4 honorary degree recipients. These individuals were selected by the faculty and awarded honorary doctorates of education by the Board of Trustees of Wheelock College because of their pioneering work in the fields of child life, education reform, and global health. You can read more about each of them in your program so that you can understand a little bit about why they represent some of the wonderful work done here at Wheelock and also why they were selected to receive honorary degrees. It's my pleasure to introduce our 2018 commencement speaker. You're going to learn a lot more about him in a few moments, but I'm just going to tell you a little bit of personal information about him. I got to know this man a few years ago when we worked together at Southern Methodist University. And I learned that he's a very special person who has led many lives, not just one, and comes to us today with an understanding of the work that our graduates have entered into and that our faculty and alumni of Wheelock College have done now for 130 years. Our 2018 commencement speaker, Dr. Eric Gordon Bing. Eric?
President Chard, thank you for that gracious introduction. 130 years ago, Lucy Wheelock founded the Wheelock Kindergarten Training School that would one day become your alma mater. She came of age at a pivotal moment of time, a period of our history when there was rising wealth yet terrible inequality. Poor immigrant families flocked to our shores, hoping for a better life for their children, only to face discrimination because of the countries they came from. And though slavery had ended, the Ku Klux Klan and Jim Crow laws rose to restrict opportunities for African Americans, and many end up lynched, just like my great-grandparents. Even white women born into privilege like Lucy Wheelock understood discrimination. She would be 63 years old before this government allowed her to vote. It was during this pivotal moment of time when she opened the school. You see, Lucy believed in social justice. She believed that early childhood education kindled benefits that could last a lifetime. She understood the challenges the poor faced and said if we focus on strengths, not limitations, all people, even poor immigrant children, could learn and grow. But Lucy did far more than talk about justice. She acted on those beliefs. And I know you've already spoken to Lucy, but I'd like to know, in this moment, I want to hear it. Are you ready to shake things up? Oh, that is so good to hear, because you too have come of age at a pivotal moment of time when it's time to shake things up. And I can't tell you how to shake or how to pivot in those moments. You're going to have to figure that out for yourself. But I'll tell you a few things that have happened in my life and what I've learned when pivotal moments have turned my life around. It was in 1982, and I was sitting in a place like this, in a chair like that, wondering exactly what I was going to do in my life. When I finished college, I would go to Harvard Medical School, and I figured I would be a pediatrician. I really like kids. However, pivotal moments can turn everything upside down. His name was David. He was one of the first people that I met as a medical student. He was a gay man in his 40s, and he entered the hospital with an unusual disease that we would eventually call AIDS. It affected mostly gay men, and it was destroying his immune system, leaving him weak and susceptible to a bunch of infections. It killed you quickly back then because we didn't know how to prevent it or how to treat it. We actually didn't even know what it was. But worse than the disease is what it did to all of our communities and families. And that's actually what happened to David. His family rejected him out of ignorance, disgust, or fear. And what was worse than dying to David was dying alone. And I knew that nothing that I had in my medical bag could save him. So I did the only thing that I could do, that I felt competent to do. I sat down by his bedside, I held his hand, and I just listened. I listened as he felt his pain as he told me his stories of regret. I laughed when he bragged about his romantic conquests, but always the ones that got away. It was clear that he found talking helpful, and I was glad when he started calling friends. They'd come to see with him, and one by one, they would laugh with him, they would cry with him, and then they would finally say their goodbyes. And when David died, he left without shame, and really he knew that he was both loved and he was not alone. And it's through this process of listening and watching David die that an amazing, unexpected thing happened. I was healed. I was changed. And I had never felt more alive. I began to live my life fully and openly as a gay man, the one that I always knew that I was. After graduation, I moved to Los Angeles and I became a psychiatrist. Turns out I was actually pretty good at listening. And I figured one thing out. There was a job where they pay you to just sit and listen. I started the first mental health clinic for people living with HIV in South Central Los Angeles, one of the poorest areas of town. With others and for others, I began research centers to find new ways to prevent HIV and to train young scholars to do the same. Our centers expanded throughout the world. And along the way, I too found love, and we adopted a baby boy. That baby is now a young man, 25 years old, who's graduated from college and is finding his own path. In the pivotal moments after college, I learned lessons that I will never forget. I learned that it's not how long you live. What really matters is how you live and how you give. I learned that when you live your truth and use your strengths, you can transform sadness into joy, despair into hope, and even death into life. And I learned that when you work with and for others, you will inspire a world of good. Another pivotal moment occurred in 2010. I was at my computer working, though if truth be told, I was probably procrastinating, because I heard this bling, and I knew exactly what it was. It was a new email in my inbox, and I opened it to see what it was. That's what you do when you're procrastinating. It was from someone whom I didn't even know. And had I been thinking, I would have deleted it on the spot, because I was to find out that it would turn my life around. It was an email to inform me that President George W. Bush was planning to open up a new presidential center in Dallas. A headhunter wanted to know if I knew of anyone who might be interested in developing and leading the President Bush's new global health initiative. I was intrigued. I had been working in Africa for nearly a decade at this point. Global health policies during the George W. Bush administration had saved millions of lives from AIDS. In 2002, President Bush launched and championed an initiative called PEPFAR, which brought life-saving AIDS prevention and treatment to developing countries that were being destroyed by the epidemic. And the focus of the Bush Institute would be helping to eradicate cervical cancer in Africa. And I knew that was a really smart choice to focus on that, because early stages of cervical cancer can be diagnosed with simple household vinegar. With just a few drops, a clinician can see a white lesion and then burn it off on the spot with a cold probe. It cost just a few dollars. But even though it was inexpensive, most countries didn't have systems in order to do this. And 80% of the women who got this were living in developing countries. And there was just one problem with the job. It was in Dallas, Texas. For you see, all of my life, I've been happily hopscotching between deep blue enclaves in New York, in Massachusetts, in California. And I can hear from the laughs, you understand what I mean. I felt accepted in these places. To be honest, I never even considered going to a red state. I didn't know that they accepted people like me. But my interest in the job was far more than just professional. For me, it was also deeply personal. You see, my mother had been diagnosed with cervical cancer, so I understood a bit about the disease. And I was with her as she held on to hope, hoping that it would all be okay. For you see, she was not just a wife, but she was also a nurse to my father, who had been severely disabled by a stroke. He needed her. We needed her. She couldn't die. But that's exactly what she did one day as I held her in my arms. And I decided that if I could just save one woman, it would give my mother's death and my life meaning. And so I took the job and moved to Texas, and it changed my life forever. We launched an initiative called Pink Ribbon, Red Ribbon about 9 months after I arrived. It was a public-private partnership designed to reduce deaths from cervical cancer and breast cancer in Africa and Latin America. The first country we started in was in Zambia, in sub-Saharan Africa. I'll never forget a woman I met in Caldwell. Her name was Mildred. I had spotted her standing in a long line of women to be screened outside the clinic. Unlike other women who seemed to be there with neighbors and friends, Mildred was all alone. And I wondered why she was so frightened. Why had she come by herself? Did she know something that she didn't want others to know? Was she already having symptoms? Had the cancer already spread? So I joined the nurse in the exam room before Mildred entered and stood on the side to give her privacy. The nurse explained the procedure and put some drops of vinegar on her cervix. Mildred clutched onto the table and held her breath, and so did I. And we waited, and we waited, and then the nurse peeked up her head and said, "It's okay, honey. Everything looks perfect." And for the first time, our eyes met, and Mildred softly smiled. And something in her, perhaps it was a reflection of my own mother, that let me know that she too was smiling. Everything was okay. Everything was different than I had planned when I left college. However, it all seemed to be effortless to me, that I was going easily and things were perfectly aligned for me to end up in this moment with Mildred in this room. What had I done that had made a difference? And while journaling one morning, I figured out what it was. I had learned to turn within. You see, medical school was far harder than I had expected. I had worked tirelessly to get there. Why was I so unhappy? So I began spending 10 minutes each morning just meditating and journaling, and slowly the clouds began to lift. And I turned within to find my why, to understand what gave my life meaning. I turned within to see things clearly as they are and not as I hoped they would be. I turned within and began to realize that there were not red states or blue states. There were only states of consciousness, and that's how I would win. I turned within, and I could see that the pivotal moments were not just happening occasionally, they were happening every single day. And if I aligned my thoughts and my actions with my heart, all would work out fine. Since that day, since Pink Ribbon began, we've screened over 500,000 women for cervical cancer and have provided treatment for more than 32,000 women with early evidence of the disease. And though I'm no longer at the Bush Institute, I continue to work on cervical cancer projects, now as a professor of global health at Southern Methodist University. And though I had planned to remain in Dallas, Texas for about 2 years, I've now been there for more than 8. And along the way, I once again fell in love. I fell in love with Texas. It turns out I love country music. And I have more cowboy boots than I have shoes. And you wouldn't believe it for an old Yankee like me, but a few years ago, I was nominated as one of the finalists by the Dallas Morning News for Texan of the Year. And through these pivotal moments, I've discovered that political borders can't stop a person who's guided by a purpose and who's driven by love. And that if you want to change the world, you must begin within yourself, because that's the only thing you have control over. And I can't tell you what to do to get through your pivotal moments in life, because we're all different. But whatever it is, graduates, find it. And then do it, because you've come of age at a pivotal moment when there's tremendous wealth and inequality grows larger every day. In a pivotal moment where our elected leaders vow to throw children of immigrants out. In a pivotal moment where women are treated as second-class citizens and they have to scream out, "Me too." In a pivotal moment when easy access to firearms allows children to kill children, just like what happens today in my home state of Texas, again, in a pivotal moment when we have technological power to save millions or kill them, in a pivotal moment. You see, pivotal moments create change, and change is always stressful. And I know that this is true here at the college that Lucy Wheelock founded, as it combines with the Boston University family, a place that was too founded in a pivotal moment by slavery abolitionists. But I believe in the legacy of Lucy Wheelock. I believe that her calls for social justice will not diminish, because such beliefs in social justice have been echoed by the prophets throughout the ages, and they can be read in ancient texts. Her beliefs for social justice are woven into our nation's fabric and were written in our Constitution. And her beliefs were echoed by Martin Luther King Jr. He died for them so that we may live for them in a pivotal moment. And I know that they guide Wheelock's 33,000 alumni just as they will guide you. Because Wheelock College, class of 2018, as you walk across the stage, remember you are and always will be a part of the Wheelock legacy. Take it, let it grow in you, and let it guide you through all of life's pivotal moments and inspire a world of good. Thank you.